Recently it came up, can you have a fat transfer when you're postmenopausal? Simple answer is yes. Hello and welcome to this edition of the Wise Medical Minute. Today's topic was suggested by several different people on occasion, and it was brought to my attention just last week that I have not discussed in prior recordings having liposuction after menopause. Now, one of the things that many of you might know already is one of my areas of specialization is anti-aging medicine. And it is not at all uncommon after we help Stella to get her groove back, and we restore hormonal levels and restore libido and help people lose a few pounds, and they like the way they look in their clothes. Now they want to buy some new clothes, and obviously the body contouring subject arises. Now, we also enter into this conversation when it's a multi-generational kind of intra-family referral arrangement. And it goes both ways. Sometimes an adult daughter will come in for a procedure, and the mother will get jealous and say, I want to have some of this too. Or more commonly, or more consistently, when mom has her liposuction procedure first, you can almost guarantee that the younger adult daughter is going to want to have a procedure as well. So we had great results in this context because when one or the other has had experience with the procedure, they make nice nurses for that first day or two when you could use a little help after your procedure. So bottom line is, age is just a number. But I do want to talk about some of the special considerations that are pertinent when people happen to be, at least chronologically, older than 50. They may not look it, and physiologically, when I finish with them, they're not going to look like it at all. But basically, there are some things that comes from being on the planet for 5 decades that you have to think about. Now, the oldest patients we've done on at least 3 occasions now were 76 years old. I've tied that number 3 times, but there's more than a few at the age of 70, and I can't count the 60s and the 50s. But yes, you can have liposuction and fat transfers after menopause. Now, I do like when possible and appropriate, I'll emphasize possible and appropriate, to encourage hormone replacement therapy for people considering elective aesthetic or cosmetic type surgeries because the hormone therapy actually enhances the healing process. People who are postmenopausal, there are skin changes and things that are subtle sometimes and obvious sometimes. But all those things have impact on the healing process. So when we remove large amounts of fat, obviously we want the skin to retract, we want it to be smooth, we want it to lay down and get used to its new contour. And hormone therapy can be very helpful in that regard. Now, it's an interesting debate whether it's the estrogen we use or the testosterone that we use that is helpful for healing. A lot of patients are on both, so I haven't sorted out in my mind which is most responsible. My gut feeling is because we use both most of the time, because that's what the ovary used to do, we probably have some benefit from both hormones as far as aiding in the healing process. One might recall that before testosterone was abused by the bodybuilders, it was first used as part of encouraging healing after athletes experienced injury. And it was observed that the testosterone helped with healing. Obviously, we've learned there's lots of other benefits, and women, when they have their testosterone replaced, and testosterone does get replaced in women, it becomes estrogen, and that reduces the amount of estrogen that a woman needs. And therefore, the lower the dose, the lower the risks related to estrogen. So I mention all of that because I believe both the estrogen and the testosterone play a role in enhancing the results we see when we do body contouring procedures in women who are postmenopausal. Now, when that's appropriate, I do slightly prefer that the hormone therapy be started before the procedure. Is not required. We've gotten pretty good results when people were not on hormone replacement therapy, but the healing process takes a little bit longer, and sometimes we have to use other adjuncts to achieve the same results. Now, more important than the age or the presence or absence of menstrual periods is the medical issues that occur after you've been on the planet 5 decades. Okay, the average woman experiences menopause around the age of 51. That number has been creeping up over the decades. But a lot of times, concurrent with that, you'll have issues with weight gain. So obviously obesity is of itself a medical problem, and that does have a huge impact on how we approach body contouring. I refer you to previous videos that we've done on am I too fat for liposuction. But as I mentioned with regards to age, I say the same thing for the BMI. It's just a number. But I do care about the medical conditions that come with being overweight or come with being over 50. And there's things like heart disease, blood pressure, diabetes. All these things can affect the interactions of the medications we use during a procedure, can affect the risks of having a procedure. And with over 3,500 cases, we've had 0 serious complications. And even though some of our patients are well into their 50s, 60s, and 70s, I want to keep it that way. Now, other things besides the usual heart-related risk factors would be things like connective tissue disease, conditions like lupus and rheumatoid arthritis. There's some issues with healing in these conditions and some modifications in how we treat people preoperatively and postoperatively, and more often some of the medications they're on that may have to be held for a period of days, not discontinued necessarily, or when possible changed to something else. But those kinds of conditions do bring up challenges that we have to address. Another unique consideration with the more mature patient is the risk of blood clots. So especially when there's a history of lots of varicose veins, or a history of phlebitis, or just unexplained swelling in the legs, and sometimes a workup might be needed, we do spend a little more energy exercising precautions to prevent blood clots in patients who are over 50 when appropriate. That is not necessary for everybody who's postmenopausal. Similarly, a lot of concurrent medications that one might be taking for whatever unrelated condition, discontinuing medications preoperatively becomes a little more important, or adjusting doses or using alternatives. So we spend a lot more time with the preoperative medical evaluation in women who are postmenopausal because we have to address those issues if the procedure is going to proceed safely. Now, recently it came up, can you have a fat transfer when you're postmenopausal? Simple answer is yes. Now, there's slight differences in the distribution, I'll say, of where we put the fat. We're getting more and more people using autologous fat instead of the hyaluronic acid fillers. So you can spend a lot less money on fat and get even better results when you use your own fat to chase the wrinkles that came from being on the planet 60 years. And the autologous fat can do things sometimes that the hyaluronic acid products like Restylane and Juvederm, or whichever one you might consider, sometimes we can do a better job with your own fat. So similarly, fat transfer to the breast is more common than fat transfer to the butt in the population over 50, because usually there may have been some weight loss or just the effects of gravity and time, and the breasts are not as perky as they used to be, we can restore the perkiness. And using one's own fat gets a much more natural outcome and restoring that which once was, rather than creating something fake that was not like it was ever with the implants. We don't use implants in this practice. But autologous fat transfer for breast enhancement in the postmenopausal woman is a very gratifying procedure. And yes, we have done some fat transfer to the butt as well. But that tends to be less frequently called for, sort of generational thing, I believe. Now, I do emphasize with all my fat transfers now, but especially in the postmenopausal women, I have to concurrently use platelet-rich plasma. So that's a topic for another video, another day. But I found that the healing process and the survival of the fat is greatly enhanced. So I would ask questions. If you're having a fat transfer, especially postmenopausally, is the surgeon using platelet-rich plasma to enhance the survival of the fat that's being transferred, whether it's to the face, to the breast, the butt, and even the hands. You can make the hands look a lot younger using autologous fat. Now, I like working with the mature patients. I like working with the young ones too, don't get me wrong. But the mature patients tend to follow instructions better. And they do what you tell them to do preoperatively, they do what you tell them to do postoperatively. And I believe that's the real reason they get better results. You have less issues with things like smoking and alcohol and partying too much and not getting enough sleep. All those things contribute to the good results. And it seems to be a gratifying reason why we see good results in this population. So in quick summary, the age is just a number. And we are more concerned about medical conditions that come with being on the planet 5 or 6 decades than I am how old you are. And I will encourage folks who are looking at this video to mention the YouTube special. And I'm going to assign this task to Noreen, who's our new consultant for liposuction evaluations. And she will be instructed to give a nice discount for the people who mention the 50 or 60 and sexy special on our YouTube channel. So you have to subscribe to the YouTube channel, let Noreen know you did it, and drop me a line at info@wisemedicalcenter.com, and we'll make sure if you have taken the time to listen to this video that we take good care of you and make sure you get a good deal on your procedure. Thanks for listening, and again, if you have suggestions for future topics, info@wisemedicalcenter.com.
Thank you for listening to the Wise Medical Minute with Dr. Thomas Locke. Dr. Locke addresses current events as well as important medical issues using responsible, unbiased journalism approached from a medical perspective. We invite you to submit questions or comments or suggestions for future topics by email to info@wisemedicalcenter.com. Again, thank you for viewing the Wise Medical Minute.